Strengthening hearts and empowering communities. That's the theme of this year's Annual Caribbean Cardiology Conference, to be held at the Hyatt from the 23rd to the 26th of July. This morning, to tell us more about it, Dr. Taarik Dookie, the Vice President and Consultant Cardiologist at the conference and conference chairperson, along with Dr. Marilyn Lawrence Wright, the President of the CCS, joins us here on the Now to give us some more insight. Ladies and gentlemen, good morning and welcome.
Good morning. Thank you.
And absolutely delighted to have you, because 38th edition means that something's going really right, and we continue to have important conversations. To begin, Dr. Dookie, tell me a little bit as to what the concept is, why this conference is important.
So the sad reality is that cardiovascular disease is actually the #1 cause of death worldwide, and it touches home literally. So this is not unique to North America or Europe. This is within the Caribbean and Latin America. And interestingly, and we've probably heard this comment, despite COVID-19 and these other pandemics, cardiovascular mortality is actually still #1. And we've had cardiovascular disease being #1 in the Caribbean for almost 3 decades. So it's disappointing, if you wish, that a lot of newer technologies are around, things are expanding, but yet this has not resulted in a positive impact in our population. So when it hits home, it does hit home. So we are trying to bring awareness, education, training to our colleagues, our different healthcare providers, to really tackle this, quite negative burden on our society, and not just regionally, but as I said, globally as well.
Right, and of course the regional aspect of things is where we see the partnership, and in that case, Dr. Wright, in terms of the findings or the hopeful derivatives that we'll get out of these sorts of conferences, we're talking to professionals, we are hoping to make impact. The 30th edition, what is the end point or the big picture that we hope to achieve?
Sure. So I think we're trying to, harness our local partners or regional or international partners to really come on board and work together to, as Dr. Dookie said, kind of attack this burden of cardiovascular disease that is here not only in the region but globally. I think what happens when we come together at the conference is that we energize, we hit heads together, we raise awareness in the country that we're in, and it really kind of helps to bring people on board and, really motivate people to try to make a difference, not just for the patients whom they serve, but really throughout the region. An important part of what we do is education, and I think through efforts like this, we're able to reach the public more and just raise awareness about the importance of heart disease, and then hopefully how to try to prevent it or optimally manage it.
Right. Now, an important distinction to make for this conference is that it is not actually open to the public. So yes, the awareness is there, but ultimately a lot of that education is going to some of the healthcare professionals. Give us an idea of who will be there, apart from, of course, the attendees, but in terms of persons giving that information or even hosting altogether.
So we've had, 30 years is a long time, trying to do something, and by no means perfect at all. But we try to, look at ourselves not in isolation. Sometimes we think of ourselves as a little niche entity in the middle of nowhere. But a lot of our issues are shared. A lot of our issues are unique, but they're also, very dynamic. So what's the same in Trinidad could be very well the same in Jamaica and Barbados, but it could also be different. So we try to bring regional interaction. A lot of, and this is English-speaking, Dutch-speaking, French, and Spanish-speaking territories. So although the organization is based in Jamaica, we have a wide membership, to be very fair. And then our guests, if you wish, or faculty, different people come from North America, Latin America, Europe. This year we have presenters from India, for example. Again, the global village of health is, like everything in the world, is getting smaller and smaller. So there are things that are unique, but there are things that overlap quite significantly. So as Dr. Lawrence Wright rightfully said, it's about coming together, butting heads, coming together, what works in one place may not work in a different place. But a lot of shared experiences are real, and it does make a difference, even in our little niche of the world, hearing those experiences from other parts of the world. It's not always about new things, but it's implementing things that make sense, that work, and are equitable.
If it ain't broke, don't fix it, right? That's the phrase. Now, in terms of the persons attending, they still have the opportunity to register, yes?
Yes, so it is targeted to healthcare professionals, but not doctors in isolation. So we have nurses, medical students, trainee doctors, sonographers, cardiovascular technicians, and yes, it is open registration still. Our first session starts this morning, and we have a packed couple of days, and so come, and we're more than willing to have you on board. And like I said, it's sharing, learning, and educating ourselves.
Dr. Lawrence Wright, when we spoke about, or rather what we see on screen is the call for abstracts, where we were asking persons to perhaps suggest what we should cover, essentially. What were some of the conference topics that came out of that?
Yeah, no, it's really quite broad, so I'm happy that you asked that question. It's a range, so I mean, it's material relevant to children, to adults, to women, to men, to people who are pregnant, you know, so we talk about people with cancer, so we talk about cardio-oncology, cardio-obstetrics, we talk about hypertension, you know, so we're going really across the continuum from risk factors such as hypertension to, you know, what we hopefully is not end-stage disease, but things like heart failure or, you know, things that address people who have heart attacks. So it's really quite a broad spectrum that we're covering. You know, medical, surgical, interventional, you know, so it's really quite a range.
Now, granted that we have a few days, is it recommended that you attend each and every day, or will we have the same information and access available on each of these days? What would you recommend in terms of attendance?
So, like most international conferences, it is designed to be unique on a day-to-day basis. So yes, there are persons who would find every day interesting. There's the opportunity to come for a particular day if they wish. As I said before, and it might sound like a redundant comment, you know, but the things that Dr. Lawrence Wright touched on are actually things that we see. This is not, again, first world things. We see health disease in women, in pregnant women, in older women, in men, in kids. And we're trying to touch everything that touches home in the region. So every day is actually a whole learning experience, even for myself, to hear new topics and new frontiers. So yes, you will learn something every day, I'll put it that way, but you might have a special interest where you might want to choose.
Can they look at any website or particular space to see a calendar of events perhaps and pick a day?
So the abstract that you just showed, or the website, is the CardiovascularSociety.org, and essentially it has our information, the schedule of events as well, and yes, the online registration is still open, and they can choose a day if they wish to, and pay for just that one day.
Now, are you looking forward to any particular day, Dr. Lawrence Wright? Any particular speaker even?
Any particular speaker?
Calling you for favorites.
That's an interesting question, Anko. I really am looking forward to every single day. You know, there is a presentation that's going to be given by the president of the American College of Cardiology. Looking very forward to that. Looking forward to one from the president of the Association of Black Cardiologists. And then, as Dr. Dookie said, you know, we do have quite a range in terms of, you know, English speaking, Spanish speaking, French speaking. So we do have a presentation this evening by Professor Rezier, who is coming from Martinique, and he will be talking about the impact of climate change and environmental health on cardiovascular outcomes, and so I'm also looking forward to that. So when you said pick one, it's kind of hard to pick one.
Yeah, I definitely expected that, to be quite honest, especially since it's so wide-ranged or broad-reaching, so to speak. So hopefully, even though I am not a practitioner in the field remotely, I do hope that the findings will be shared with the general public in terms of bringing that awareness and sharing some of the progress that has been made, because there is progress despite the persistence of cardiovascular disease in the Caribbean. So on a more positive note then, I do wish you guys the best in the conference, and if persons wanted to register still or be a part of it, please remind us of your contacts again.
Right, so it's all online based, CardiovascularSociety.org, and yes, click and we're all around.
You can search, you can enter, and you can be a part of this conference happening at the Hyatt from the 23rd to the 26th of July. It means today you guys are off to a good start, I hope.
Today we are, and I just want to highlight our electrocardiogram workshop, because a lot of it is kind of more abstract presentations, but today is an electrocardiogram workshop for those who want to learn how to do ECGs, who want to learn how to interpret ECGs. This morning is the morning to come down to the Hyatt Regency.
You know what that is? I felt like for a nanosecond I was part of it. But for those who will be a part, I wish you guys a very successful conference. And hopefully the findings be shared sooner rather than later to make bigger impact and strengthen the communities in which we exist.
Thank you very much.
Thank you very much to you both. Of course, Dr. Taarik Dookie, the conference chairperson, VP and consultant cardiologist, along with Dr. Marilyn Lawrence Wright, the president of the CCS, joining us this morning to tell us about the 38th Annual Caribbean Cardiology Conference happening today at the Hyatt. Guys, it now has even more for you in store, so stick around.
Thank you.
Ooh, that was a tongue twister.
You got it, you got it.